Dr. Louis B. Cady offers so many interesting treatments, innovative treatments for the problems many of us struggle with. But hormones are an issue. I think, at least they become issues for people, not just as we age, but as when we have thyroid conditions.
Right.
So when we come to you and say, I don't have any energy, I'm depressed, whatever, do you go, okay, let's talk about hormones?
Exactly. So I began, shortly after I began practicing here in Evansville in 1993, I began to get what were advertised as antidepressant failures. And they were referred to me sometimes by my colleagues, like, I have tried this person on 3 different antidepressants and nothing works. Or the patient would come in and say, I've been to 2 different doctors and they just have me on antidepressants and nothing's working. So at Mayo, I was taught we always have to check and make sure that the patient is not hypothyroid, that is low thyroid.
Okay.
So at that time, I was taught check TSH and treat with T4. That was it. That was the gospel according to Mayo. That was the gospel according to the American Academy of Clinical Endocrinology. That was the gospel according to LabCorp and how you test. Unfortunately, it's not right. And so I began to find that that was not getting my patients all the way well. There was a great endocrinologist here in town, and I sent all my patients to him that had thyroid issues, and they all came back doing great. What he did was he used a drug called Armour Thyroid, which has a combination of T4, levothyroxine, which most people are on, and liothyronine, T3, which nobody was using. Well, it's actually in my literature in psychiatry about something called T3 augmentation. So people that were not responding well to antidepressants were given T3, liothyronine. Lo and behold, they got better. So it was described as it was augmenting their antidepressants. What it was actually doing was treating an underlying hormone deficiency. So I began to get very interested in the thyroid, and I began to work it up completely in both my men and women patients.
Well, I can tell how enthusiastic and excited you are because you're seeing these results in people that have struggled for so long.
Right.
So what is the testing like to get those numbers?
Very, very easy. You have to have all of the tests ordered that you need. So the test is you go and you get stuck for blood.
So it's a lab test.
Lab
okay.
test. And it's the thyroid-stimulating hormone, which comes from the pituitary, the thyroid hormone, which comes from the thyroid gland, the T3, which is made in the liver, and then reverse T3, which is the antidote to T3, and that comes from cortisol. So you have to check them all.
And this is not a routine, like we get your blood drawn every year, they're not going to ask for that.
No, they're not. The standard test is TSH, and you get a free T4 if you're really, really lucky. You
Insurance
don't get
cover it?
Yeah, insurance will cover it all. The diagnosis is fatigue and malaise.
Yes.
If there are cognitive issues, cognitive disorder not otherwise specified. If there's depression involved, depression. And that'll justify all 4 of those tests.
Wow. So talk to your primary care person and then call you.
Talk to your primary care person. Sometimes people will ask their doctor for these labs, and their doctor will say, well, I don't know about those, so I'm really not going to order them.
Okay.
So
well, call Dr. Cady. Call Dr. Cady and Cady Wellness.
I didn't say that, Angie.
Well, but I mean, it just makes sense. If you need to know this,
yeah.
And you need to know
if
this.
you're just not getting better.
Right.
Yeah.
You're not getting better.
I'd love to see them.
Cady Wellness, right here in Evansville. Thank you, Dr. Cady.
Thank you.
More lifestyles right after this. Stay with us.